Right here, bro. Put it right here.
What do you mean right here?
Wrestling. Let's go right now, bro.
With them big ass guns?
Let's go right now.
All right. Oh, shoot. All right, let's go. Why are you leaning forward,
Ready?
bro?
1, 2, 3.
What are you doing?
Come on, bro.
What are you doing, man? Let's go. Orthopedics, bro.
What are you doing?
Ah, Lord.
On me, so I had to go run up a check. I got the message on me, ain't no flexing on me. My attorney gon' call and collect. Blessings on blessings for me. My successes only made them envious. They got upset.
What's up, guys? Welcome back to I Am Doctor. I am your host, Dr. Antonio Webb, an orthopedic spine surgeon.
And I'm your co-host, Dr. Maita, an anesthesiologist.
This show is just two docs, just chopping it up about everything outside, inside of medicine, from medicine to fitness. What are we gonna work on today?
We're gonna do some core. You know, it's often neglected. It's gonna help keep your back stabilized, like you know. So we're gonna hit some core.
All right, let's do it, man.
All right, let's do it.
So you are a anesthesiologist, right?
Yes, sir. Finishing my last year in training. And you're a spine surgeon, right?
Spine surgeon. So is this something that you always wanted to do?
Anesthesia?
Yeah. When did you decide on?
Bro, I never knew I was gonna do anesthesia.
Yeah.
How about you?
It wasn't until the end of my third year of med school.
Yeah.
That's when I decided upon orthopedics, and then my fourth year of residency for spine surgery. So,
Okay.
but when did you decide? Like, did you go into med school knowing what you wanted to do?
Anesthesiology?
Yeah.
I didn't even know what an anesthesiologist was.
Yeah.
I went to med school actually wanting to do hand surgery, believe it or not, because my mentor was a hand surgeon, and I just loved what he did. But it took me a while to figure out what I wanted to do. But you kind of had it figured out from the get-go, or what?
I mean, as soon as I was born, bro, I came out the womb. Like, now I'm about to do ortho. No, I mean, I think most students decide on a specialty in their between their third and fourth year, during the rotations. Some people I have a lot of pre-med students that were like, hey, I don't know what I want to do, and they're freaking out, and they're worried about finding a specialty kind of early on. You don't need to know what you want to do.
Yeah.
I think it's important to just know that you want to become a doctor, and you'll figure it out once you do your rotations.
Yeah, I agree with you. I think having an open mind during residency sounds super cliche, honestly. I used to hate hearing that. But really, when you're going on your rotations as a med student, have an open mind and do each rotation as if you're that doctor, as if you're a pediatrician, a trauma surgeon, anesthesiologist, ER doc, whatever. I was actually also interested in ER for a while because I like procedures.
Oh, me too.
And I actually applied to ER. I had sub-Is set up, everything. And then, you know, last minute I changed to anesthesia because one of my mentors was like, you should also do an anesthesia rotation.
Yeah, I mean, I maybe most other people were like this too. I liked every specialty that I rotated at.
Yeah.
I was just happy to be in the classroom, out of the classroom, and then in the hospital, like, working.
Because that's what we all work for, is to be in the hospital. And I think that's common. Like, a lot of people like a little bit of everything.
Yeah. So each rotation, I mean, internal medicine, it was fun to me just because it was something different. I wasn't sitting in my room studying every day. Anesthesia, that's one rotation I did not like. I'm sorry, bro. I mean, I was so into the surgeries, I would like look over the drapes and like, hey, what are they doing? They got someone's belly open. That was so cool to me. Mm-hmm. You guys are just sitting back there. No disrespect to anesthesiologists, but
We're gonna fight after this, man. We're gonna have to box after
whatever
this.
you want to do, bro. Yeah, I mean, for me, that wasn't for me.
Yeah.
I needed to be doing something with my hands. I love working with my hands.
And the thing is, in anesthesia, though, we do work with our hands. I mean, I'm putting in lines all the time. I'm putting in, like, lumbar drains. I'm doing procedures on patients with ultrasound. I'm numbing up their nerves before surgery, you know, to get the pain, to help them with pain relief. So we actually do a lot of procedures. Anesthesia is a very cerebral field, you know what I mean? So I really enjoyed pharmacology and physiology, and so that's all anesthesia is. We're gonna do one more here.
Yeah, I agree. You know, med students who are trying to decide on a specialty, I think in a big picture, how to choose a specialty, you have to think about whether you want to do something surgical or be very cerebral. You can have a combination of both.
Yes.
Like nephrologists, they're more cerebral, but they do a lot of procedures too. They do some procedures.
Yeah.
Internal medicine doctors, they do, paracentesis and all other types of central lines. They do all these things, but you have to see, like I love being in the operating room.
Yeah.
Some people hate it.
Yeah. I also like being in the operating room too. And I like, I did like math growing up. So in anesthesia, there is some math involved. You have to, estimate the patient's blood volume. Oh, how much blood can they lose? And if they lose this much blood, when do I have to start giving blood? And oh, for this patient though, he has cardiac problems. Maybe his threshold is a little bit higher. And so in anesthesia, I think it's a good mix. But I respect surgeons so much, because as a surgeon, you go to the OR and you operate. You go around on your patients, and then you go to clinic. Yeah. And that's, you guys are doing a lot for the patients. We're just kind of centered in the perioperative period.
Yeah, so the different personalities as surgeons, I'm pretty sure you've come across a lot of surgeons that are a-holes and the different personalities. How do you deal with that?
Quite pleasant. Quite pleasant.
How do you deal with that, man? Dealing with different personalities every day.
Honestly, that needs a residency for itself.
Yeah. Yeah, because, in my rotation, general surgery rotation, there were some rude-ass surgeons, man. They would yell and throw things.
Why do you think that is?
I think it boils down to the personalities in medicine. Mm-hmm. When you're choosing a specialty, you have to think about what personality that you have matches up with whatever specialty.
Okay.
So pediatricians have different personalities than a surgeon.
Yeah.
Do you agree?
I agree. 100%.
A psychiatrist has a different personality.
Yeah.
So as a surgeon, we're go-getters, man. That's why I'm up, I'm ready to go, I'm pumped.
Yeah.
You have to do that, especially when you have someone's spine. I'm working on their spinal cord or compressing their spinal cord. Or if you're a heart surgeon, to crack open somebody's chest.
You gotta be on it.
You can't be timid. I don't know if I can open up their chest.
I've seen surgeons like that. I'm like, man, this is gonna be a long case.
Yes, but at the same time, as a surgeon, you gotta get this shit done.
Yeah.
Do you agree? What's the personality of an anesthesiologist?
That's a good question. So to be honest, I don't think I'm like your typical anesthesiologist, because typical anesthesiologists, I'm pretty chill, but they also have to be a little passive, to be honest with you. And what I mean by that is they just kind of have to let things go sometimes. But for me, if I'm in the OR and I have a concern, I'm not afraid to tell the surgeon, because at the end of the day, it's all about the patient, right? And you got to be an advocate for the patient. And so, those are the kind of things that I see as myself an anesthesiologist that may not be as common as others. But as an anesthesiologist, you really got to know your pharmacology and physiology. Because you're like the internal medicine doctor in the operating room. Because I know you guys don't know your internal medicine.
Hey man, what's the blood pressure? What's the glucose? I don't know anything about managing glucose. No, we know that stuff, man, but I think it's best taken care of by somebody who does it all the time. I don't want to sit there and titrate an insulin drip or propofol. I just want to cut.
Yeah.
I love cutting, bro.
Yeah.
So it's cutting season. That's why we're in this gym.
Yeah, everyone, has what they're good at, and everyone's meant for what specialty they go into. I think, how about fellowships? Does everyone have to do a fellowship?
Not in orthopedics.
This is going to be the last one.
90% of people in orthopedics do a fellowship. It makes you more marketable. It makes you, like a spine surgeon, only a few people can do spine. Like in the hospital, if a patient has a spine injury, they can only call spine surgeons. They can't call a general orthopedics. Yeah. Or if you're sports medicine trained or joints trained or hand trained, you can't do spine surgery.
So it makes it a little more valuable.
I can do hand surgery. I can do joint replacements. I can do, shoulder scopes, knee scopes. I can do all those things. Spine surgery makes you more marketable. Mm. And that's the reason to do a fellowship. I have a video about the return on investment of orthopedic fellowships. The only one, or the few ones that was actually gives you a positive ROI is spine surgery.
Yeah.
A lot of the other fellowships give you a negative ROI, return on investment.
Interesting.
Because you're missing out on $500,000 by doing that 1 year training.
Yeah.
For most.
Yeah, it's an investment. And for those people who don't know what a fellowship is, After you complete residency, you can go into some additional training, and that training can vary from 1 year, 2 years, 3 years, just depending on the specialty. But you become subspecialized in your specialty. Like anesthesiology, there's multiple avenues you can go. You can go into critical care. You can go into chronic pain management, which is what I'm going into. You can also go into other specialties that are just arising, like regional anesthesia. You know, when you ask the anesthesiologist, hey, can you numb up the patient waist down so we can do this knee surgery? You know, you can become an expert at that too.
So how long are those fellowships in anesthesia?
So chronic pain is 1 year, pediatrics is 1 year, cardiac anesthesia is 1 year, critical care is 1 year. So most of them are 1 year.
Yeah, same in orthopedics.
Yeah.
All of them are 1 year, except some oncology, which is like cancer, tumors of the bone.
Yeah.
Some are 2 years.
And that's something to consider when you're going into the residency. It's like, if you want to do fellowship, do you want to spend another 3 years doing the fellowship or 1 year doing the fellowship?
Yeah, and I guess a good question, this is what I get all the time. People want to go into anesthesia because of the lifestyle. It was like, hey, I'm going to have a cush lifestyle, I'm going to work these hours, I'm going to have this great life. Is it really that good of a lifestyle?
Look, I'm not the best person to ask because I'm still a resident. And I will tell you that residency is hard in anesthesia. It is, because I'm up when you're up, bro. Yeah. When you're amputating someone's knee or something like that, I'm up doing the case. So, it's hard for me to speak about the lifestyle of anesthesia because I'm not in private practice. But overall, people say it's good. But I think in every specialty, you can dictate your lifestyle depending on how much you want to work, right?
Absolutely. If I have a surgery, emergent surgery at 2 o'clock in the morning, guess who has to be there? The anesthesiologist.
Yeah.
So I can't do the surgery on my own. I need someone to put the patient to sleep, to give them medication so they're comfortable. So an anesthesiologist can have a very busy schedule too. But like you said, in private practice, I can make my schedule however the fuck I want to make it. Like it's my own business. So if I wanted to work 3 days a week, I could do that.
Yeah.
I just have to pay my overhead. I got to pay my overhead. So people they're choosing specialties based off how busy the lifestyle will be. Like you can make your lifestyle whatever you want it to be. Mm-hmm. You agree?
Yeah, I agree.
So should people go into a specialty for the money?
And that's a good question, because once you get in med school, you're going to start accumulating some debt. I mean, most people will. And so, that's something you have to consider is, hey, do I want to do this specialty and make X amount of money and take longer to pay off my debt? Or do I want to, spend some more time and get in this other specialty so I can pay off my debt faster? I will say try to pick something that you love, which may be difficult, but try to pick something that you like. Because doing something that you don't like for like 20 or 30 years is going to catch up to you, which leads to what? Burnout, suicide even, and
that's the key what you said. You got to think long term. Don't choose a specialty based off how hard you think the residency will be.
Yeah.
Every residency is going to be hard.
Yeah.
Family medicine residents,
they work very good point.
They work hard. So I had this misconception that I should go into emergency medicine because it's only 3 years of training, and then I'll get out, go make all this money, and just work a couple shifts here and there. But that's the wrong way to go about it. You need to think about a specialty, thinking long term. Like, look 20 years down the line. Like, what do you see yourself doing? What will make you happy? If you got a call at 3 o'clock in the morning, you got to make that drive into the hospital to see a patient. You don't want to do that with a specialty that you barely like, or you're doing it for the money.
Yeah.
So.
And it's only going to make you a better physician if you actually like what you're doing, because then you're going to be motivated to keep up with the literature and keep studying. And so it pays off in the long run, in my opinion.
Yeah, what other specialties were you considering in med school? You mentioned emergency medicine, but why didn't you go into be here?
One of the reasons why I was like gung-ho about emergency medicine, man. I was like all over that. But one of the reasons why I didn't go is like I was realistic with myself is at the beginning of emergency medicine as a private practice attending, you might be doing a lot of night shifts and shifts that are kind of all over the place. that'll disrupt your circadian rhythm. I mean, I don't think this is true across the board, but I do think that there is a period of time where you have to earn your rights in the group you join, right? And at the same time in emergency medicine, I just didn't like the fact that I went home and I was like, oh, should have I ordered this test? And oh, did I discharge that patient too fast? And I didn't like that I didn't have complete closure on everything.
Yeah, I agree. Yeah.
And that was a very hard decision for me to make. And
Continuity of care.
Continuity of care. And the thing is I respect emergency physicians. They have a lot of skills. They can intubate, they can put in lines, do minor surgical procedures. But for me, I wanted to be an expert at one thing. And so that's what drove me to anesthesia. It's similar to emergency medicine in some ways, but that's what was appealing to me.
Yeah, when I was thinking
what other specialties were you considering?
So number one was urology.
Okay.
I didn't want to be called a penis doctor my whole life. The second one was emergency medicine, but I looked at the physicians who were 20, 30 years out of practice, maybe 50, 60. You don't see a lot of older ER doctors.
Yeah, you don't.
But in orthopedic surgery, I know plenty of physicians who are like 70 years old. They may not be operating, but they can still do some things. They can teach, they can see patients in clinic, they can do some consulting. So there's lots of other avenues that you can do when you start operating.
Yeah.
So
you got to think about longevity and what you can do for a while.
Yep, absolutely. What do we hit now?
We're gonna just do some of this medicine ball business.
So for me it was emergency medicine. It was urology, and then
on both sides.
that decision to go into orthopedic surgery,
Then come back to the middle.
that was a hard decision to make, but at the same time, when I finally made that decision, it was the best feeling ever, man. I was like, this is what I want to do for the rest of my life. When it finally hit, I remember that day. I was in my apartment in DC. I was like, well, I want to do orthopedics.
Oh, really?
Yeah. Yep. How was that kind of process for you? And like when you finally realized, hey, I want to do anesthesia. And are you happy with your decision? So
Yeah. Ready? All right. So like I told you, for me, it was a big learning process. But I finally realized it like in August of my 4th year. And then when I matched, I was like, okay, I'm happy I got into this because, part of the reason is I wanted to do chronic pain. And so I was like, okay, this is perfect. I could do anesthesia and then I can also do chronic pain afterwards. So I was super happy about that.
what are some downsides of anesthesia?
So every specialty has its positives and negatives, right? For anesthesiology, if you're not a morning person, don't do it because you're gonna have to get up early and set up drips and get the operating room ready. The operating room doesn't magically set up itself for the surgeon. The other thing is if you kind of like to run the show or like be the boss, don't do anesthesia. And I'm keeping it real because at the end of the day, surgeons, bro. Surgeons.
Say that again.
Surgeons. But when ish is hitting the fan, we have to take over.
You're right.
And that's okay. There's a place for everyone.
No, I don't think we're the bosses in the OR, the king or running the OR. It's a team.
Yeah.
We work together as a team.
I
So
agree with you.
everybody has to be harmonious, just like in a symphony, man. Every instrument, the person that's orchestrating everything.
100%.
The OR nurse is important. The housekeeping is important. The anesthesia tech is important. Everybody's important.
Yeah, I agree with you.
I will never walk into the operating room like, this is my OR. Everybody.
You were doing that the other day, bro.
That was just one time, bro. Let me live, bro. I'm just out in practice. Let me live a little bit, bro. So, but it's a team. It's a team mentality.
Yeah, hold on. I will tell you that, but at the end of the day, everyone has their roles in the OR, right? When things are going bad and the patient's crashing, the surgeon steps aside, lets the anesthesiologist lead the way. When things are going smooth, you let the surgeon lead the way. It is what it is. That's just how the OR culture works. if you want a lot of appreciation, you know, in medicine, like if you want patients to send you gift baskets and fruits and presents on the holidays, don't go into anesthesia, because your patients aren't gonna remember you and they're not gonna know who you are. Because guess what? You're putting them to sleep, they're waking up, and that's it. And if they don't remember you, it means you did a good job.
Yeah, you're right. So that's what I love about surgery, is that immediate gratification that when patients come in, they may have a hip fracture or a huge disc herniation and they're just in excruciating pain. I can do something that can make them feel better. Yeah. I just did a surgery this past week. I'm doing some general orthopedics, so I did a knee replacement. The next morning after surgery, the patient was like, wow. He's like, I haven't got this much sleep in years. Wow. And he was so happy, man.
That's awesome.
That made me feel so good, because I was kind of worried about him, and you know, with the surgeries, you always worry about, hey, did you do everything right? Did you miss something? Especially as a young surgeon. So that was you know, really good to hear.
Yeah. Let's have you lay down here. There you go.
So you mentioned the cons of anesthesia.
Yeah.
What are some pros?
So there's a lot of pros to anesthesia. First thing is here, go ahead. There you go. So first thing is you get closure with anesthesia. So you go home, you know the case went well, you know that the patient was stable throughout the case, and that's what I love about it. The second thing is you really get to connect with patients and build their trust in a short period of time. And I can't tell you how valuable that is in medicine, you know. And also in anesthesia, you really get to apply all the concepts you learned in med school in real time. So like, given medication, boom, there's that instant gratification. You see the mechanisms of action right before your eyes. And I love that. I also love all the procedures that you do. You get really good with ultrasound. And you know, in addition to that, once you build those skills, you can carry them over and do something like chronic pain like I'm doing.
It's not like that in orthopedics. I see fracture, I fix.
Yeah.
No, I mean, some pros of orthopedics in general than spine surgery. You know, some pros are that, like we talked about, the immediate gratification. I love that aspect of it, that, you know, I can do something in surgery or non-surgical that can change someone's life. I love the fact that it's a very collegial type specialty. You know, you hear about all the, oh, they're jocks or athletes that are in orthopedics, you gotta be 6'4", 250. That may be true for me. No, it's not true, but I know a lot of female orthopedics. We need more female orthopedics. My chief resident was like 5'2", like 140 pounds. So that misconception that you have to be this certain physique or you gotta be an athlete or a jock for orthopedics, that's not true.
Yeah.
So, but some other pros, it pays really well. You get compensated really well.
Yeah, anesthesia too pays well.
And then, yeah, it opens so many avenues that you can do, from consulting to product development to engineering, like designing different implants. Yeah, I mean, it's a great field. I don't have any regrets.
For sure. I will say with anesthesia too, you do get a good work-life balance because your work stays at work. And sure, you might have to take a call or two every month, but when you leave the OR, you leave the OR. I mean, you don't have clinic, you don't have to round in the morning, you know? So that makes a profound difference and frees up a lot of time throughout your day. And that's, you know, what I enjoyed about anesthesia. But, you know, I also miss the continuity of care. That's why I'm going into chronic pain, because I also want to help patients through, you know, a multifaceted approach, like nutrition, do interventions to help them get rid of their chronic pain and give them like a head start on their road to recovery. And you know, you work with chronic pain physicians all the time.
Yeah, so as an anesthesiologist, you mentioned that you kind of leave work at work. You think?
Yeah.
As a surgeon, that's the downside.
Yeah.
I'm always thinking about patients. I just did 3 surgeries this past week. I'm worried about those patients. I want to make sure that their wound is not, you know, getting an infection, that I actually relieve their symptoms. I think about them a lot. I stay up at night and I think about my patients.
Yeah.
That's the downside.
Yeah.
I should spend time with my family. You should be able to leave work at home, at work, and then home at home. So that's the downside. There's a lot of preparation that goes into surgery. A lot of, like you said, I have to round in the morning. So sometimes I may have to go 3 or 4 different hospitals to go see patients.
Oh, really? So travel around?
Yes, a lot of travel. Because certain insurance types, I can only do their surgeries at certain hospitals. Or the patient may be sick enough, or may have some cardiac problems. I may want to do them in a heart hospital, which may be 20 minutes from my house. So I calculated the other day, I was like in my car for like 45 minutes. I had to go to 2 different hospitals. I had patients in office. I had to go see a consult. So, you know, that's a downside. But as a business owner, all those are expenses. That traveling, the mileage, the gas, those are your expenses.
Oh, okay, so what do you do with those expenses?
Well, I mean, those are things for your CPA to kind of incorporate into your taxes.
Oh, okay, yeah, that makes sense.
Yeah. All right, great workout, man.
Yeah, man, great workout. All right, right here, bro. Put it right here.
What do you mean right here?
Wrestling. Let's go right now, bro.
With them big ass guns?
Let's go right now.
All right. Oh, shoot. All right, let's go. Why are you leaning forward,
Ready?
bro?
1, 2, 3.
What are you doing?
Come on, bro.
What are you doing, man? Let's go. Orthopedics, bro.
What are you doing?
Ah, Lord. Oh, man.
He's going easy on me, man. He's like, let the anesthesiologist have his win.
Yeah, you guys got to win sometimes.
But good workout, good talk.
Yeah.
I think it's going to benefit a lot of people. There's a lot of confusion around this topic, and I wish I had someone break it down, honestly.
Yeah, I mean, mentors are important. You have to find someone in a specialty that you're interested in and talk to them, ask them questions, or especially someone who has just went through the process. Like a 4th-year med student who just matched, perfect person. They just went through the process.
Yeah.
How important do you think mentors are?
Dude, I'm so happy you mentioned that, because instead of you figuring out everything, you could just find a mentor and take that shortcut. Find a mentor, take that shortcut. I'm a firm believer in not reinventing the wheel. You don't have to do that. Someone's already been through it. Just talk to them, drop your ego a little bit. It's okay to ask for help. Okay, you're not Superman. It's, you know, it's invaluable. Like, there's so much benefit from mentors. I mean, they've already been through it all. So
Yeah, even being done with all my training now, I have mentors that I call, text all the time.
yeah,
It's all about relationships in medicine, especially as a surgeon. You know, I did over 2,000 surgeries as a resident. I don't know, another 300-400 as a fellow.
nice.
So there's still stuff that I'm not comfortable with. You have to be okay with that as a surgeon. You have to know your limits. A good surgeon is going to tell you, I'm not comfortable doing that. And then you ask for help. Going out into practice, I think mentors and senior people that are around, I'm in a group with 10 surgeons.
Yeah.
It's been invaluable. I can't speak enough about how important that is to have senior mentors when you're out in practice.
Yeah.
Just because there's still going to be things, on this whole 15 years of training, there's still things that I'm not comfortable with or don't know. I have to read a lot. I have to look at articles and research. You have to constantly educate yourself.
Yeah.
And, that's one of the things that I found to be most invaluable is having guys around that I can ask questions. I can
Absolutely.
talk to them about my cases that I'm doing, talk to them about my surgeries that I'm doing. A word of advice for students out there, and also you having a mentor when you get out into practice.
You've been teaching me a lot, man. I appreciate it.
Yeah, I mean,
I'm very grateful.
Having people that you can also in pain that you can do some procedures with, or you can run some patients by, because the patients are not they're not to the textbook.
Yeah.
No patient's going to come in just like a textbook. You have to think about your education, you have to think about your training, your experience, and then formulate a plan for the patient.
100%.
That's what MD make decisions.
Yeah. Yes, sir.
Or make dollars.
Yes, sir. Another thing about that is during residency, find mentors.
Yeah.
You're not the best doctor in the world. Find mentors. As a pre-med student, go to the tutoring center. Hey, I'm not good at OChem. Can you throw down some techniques here? Can you help me out? Find some mentors. And fellowship. This is all mentorship, everything.
Yeah.
If you're going to sit there and reinvent the wheel, hey, good luck. This is going to be a long process. Suck up the ego, ask for some help. It's gonna be okay. And guess what? Guess what's the most important thing? Giving back. You gotta give back. Because when you give back, it comes, unintentionally comes back 100-fold. And at the same time, that's why we went into this.
Yeah.
To give back.
Yeah. If you had to do anesthesia over again, would you do it?
Tune into the next episode of because I want to go into chronic pain, yes. But I would have also considered sports medicine, even physical rehab and PM&R. I don't know too much about it, but because you can go into chronic pain. And maybe even emergency medicine, because you can go into chronic pain through emergency medicine. It's a little unorthodox. But I would do anesthesia for that reason again, yes. And it's a good backup plan.
Yeah, same here. You know, I would definitely choose orthopedics again. I'm biased. Every rotation for the med students out there, they're going to tell you, if you go on a cardiology rotation, they're going to say cardiology is the best field. If you go on an anesthesia rotation, don't let them lie to you. They're going to say anesthesia is the best field, especially orthopedics. But yeah, man, great workout today. Great chatting with you. Let's do that arm workout again, that arm wrestle. Rematch, bro.
All right.
Let me stand up a
You
little
gonna
bit.
go home and train or what?
Work out just bicep tonight.
All right, ready? One.
Nah, you let me do that, bro. Come on, man. Nah, be for real, bro. Come on, man. Don't be easy on me, man. Let's go, bro. Orthopedics for. Why are you? Look
Bro,
at
this is the technique here, bro. This is the technique.
Look at the angle.
Okay.
Put it 90
gotta talk
degrees.
about angles and stuff.
Put it 90 degrees. Come a little forward. Let me stand up a little bit.
Okay.
Dude, look at your angle.
How's my angle?
You're leaning forward too much.
What are you talking about, man? Bro, you already have me halfway down, dude. I see your strategy, bro.
Ortho versus anesthesia.
All right, ready?
What you got?
Where you at, bro?
God damn. All right, man. This is I Am Doctor. I'm your host, Dr. Antonio Webb.
Dr. Maita, we'll see you on the next episode.
See you next time.
I heard they checking for me, no one checking on me, so I had to go run up a check. I got the message on me, ain't no flexing on me, my attorney gon' call and collect. Blessings on blessings for me, my successes only made him